Hey, good morning. Dr. Ferguson coming to you from the Passioncam. Today I thought I'd just talk real briefly about depression. Depression is real, undeniably, but can be treated. Now, a lot of times in the office, women will come in and they'll say they're depressed, or they'll say they're sad, or they're down about something. But men will come in and they can be just as gloomy as they could be. They could be not sleeping, excessive eating, not want to go to work, not want to do anything, not want to go out. Just all the signs and symptoms of depression. And they'll sit there and say, well, I'm not depressed. I feel fine. And you know how you on the clown's face where the face is upside down face. That's the way their face will look, where the mouth is an upside down mouth. But the whole time they're saying they're not depressed. For some reason, men have a very hard time saying they're depressed or even talking about the issue. Now understand, depression most times is not going to be like you see on television. Somebody's sad, they're down, they go in the corner, they won't talk, won't eat, won't do anything. That's not what you're going to see 99.9% of the time when you talk about depression. It's going to be the average person sitting next to you. It's going to be your coworker. It's going to be, any of those people could be depressed. And so don't just think because you don't fit the bill of the television depressed person that maybe you're not depressed. It's important to share that information with your healthcare provider so that they can look into it more, maybe able to find some things that can help you. And one of the things I find that's really very simple to go after depression, and that is to check the hormone balancing. And what I find with women, it's probably true for men, but I don't know because I haven't done it enough with men. But what I find with women between the age of 20 and 50, if they're depressed and I check their hormone balancing, and I find there's some significant abnormalities in the relationship of hormones, and I can correct those hormones, which we're able to do with natural hormone therapy, most times that person's depression will be brought in check. Now, will it be completely eliminated? I don't know if I can say completely eliminated, but I can definitely say most times it will be brought into check because depression has so many components to it. And the prescription medicine we have for depression, it works, but it doesn't address the hormone components, and it doesn't address many other components as well. So, the next time you're having an issue, think you might be depressed, yourself, your loved one, have them get checked out and go to a doc that has some understanding and insight into depression so that they can help you along the way, whether that be your family doc or whether that be a psychiatrist. Go get help. You don't have to go around depressed because we do have good treatment in this day and time. And especially you men, don't go around depressed. You don't need to be depressed if we can treat it. Maybe we can't treat it, but maybe we can. But it starts with you being honest with yourself, your loved ones. Say maybe I'm not quite right. Maybe you don't want to use the word depression. Say I'm anxious, I'm uptight, I'm a little sad, I'm a little down. We don't have to use the word depression if you don't want to use that word, because that word carries a negative stigma for many people, and I guess that's why men shy away from it. I don't know for sure, but there's probably many reasons, but I know in general men have a hard time saying they're depressed. On that note, depression can be treated. This is Dr. Ferguson coming to you from the Passioncam. Be blessed and have a wonderful day.